Hey, it's Dr. Brian McKay, Core Health and Darien, and today I'd really like to discuss headaches. I'm starting to see a number of headaches. I don't know whether it's because it's pollen season, whatever, but the fact of the matter is, a lot of headaches can be treated successfully with chiropractic care. I just had a patient recently start headaches for 20 years. Now, I don't know anybody that wants to take on a case of that, but can you imagine this lady's been suffering for 20 years, trying everything, and getting absolutely no results? So I'm kind of excited about taking the case on, but it made me think that there are a lot of people suffering from headaches out there who don't know that chiropractic care is one of the single most effective things. And you're not going to hear it from your primary care doctor. They don't understand. The vertebrae in your neck support your skull. So here's a couple different ways headaches can really start as a result of the neck vertebra being subluxated. What'll happen is you have a normal curve. A curve from the side looks like a reverse C shape in the neck and as well as in the lumbar spine. Excuse me. And when that curve is lost, you lose mechanical efficiency. Now, mechanical efficiency may not mean much to you, but would you drive your car with 20 pounds of pressure on the tires on the left and 32 pounds of pressure on the right? No, it interferes the way the car will operate mechanically. So when you lose the curve in your neck, the mechanics are changed, and now instead of the weight being borne in the back, and we call the back of the vertebra, we call them facet joints. Um, the facet joints meant to bear the weight. In the front, you have the spacers called the discs, and when those spacers start to pick up more weight than they're supposed to, they wear out, leads to arthritis. But as far as it relates to headaches, have you ever stopped to consider that the base of your brain goes down? The base of the brain actually goes down into cervical number two. So it just doesn't stop inside your skull, it goes down. So the brain stem can be quite a good source of headaches. I mean, if you've ever hit your thumb with a hammer, right? So what'll happen is obviously it hurts. And it can hurt for a long time. It kind of stings. Well, think about your brain tissue. I'm not talking about your brain tissue getting clamped on. And you know what? It needs the tension off. So there's an opening at the bottom of your skull called the foramen magnum. Foramen is Latin for hole. So if you're ever on a talk show, game show, you need to know what foramen is. Now you know. And this opening is where the brainstem starts to become the spinal column. So if you have pressure on the spinal column from the biomechanically inefficient vertebra pushing against it, you have all kinds of tension. I mean, also all kinds of aberrant signals going to the brain. So there's a lot that we can do to mitigate this as a chiropractor. And the thing is, we're not pumping you full of drugs. I mean, Botox costs $5,000 a month, right? So $60,000 a year. I would hands down bet I could do a 10 times better job than Botox, but you don't get the cooperation of the medical profession. They just don't see it. It's not being taught. It's not being supported by Big Pharma. I mean, Big Pharma, listen, if they're selling you $60,000 cure for a year, and that's the understanding they're not fixing it, you're going to have headaches the rest of your life at 60 grand. Um, I don't think so. I mean, fortunately, some people do outgrow headaches, but the challenge here is how do you reach out to people and open up their minds to the fact that there is sometimes a better natural solution to different entities. And chiropractic is very simple. You take the tension off the nervous system and let the body heal itself. And I know that sounds like everybody, you've probably heard it all before, but the fact of the matter is, you tension on the nervous system is a form of stress. Now, you think about mental stress? Well, I'm talking about a physical stress. Physical stress that your brain is aware of constantly. Constantly. What happens? Well, you suffer. I mean, the quality of your life goes down with long-term chronic headaches. And I wish I could tell you that I could wave a magic wand and have your headaches gone, magically. It doesn't happen that way. Quite honestly, I'd be full of it if I told you that. But I can tell you one thing. If you gave chiropractic care, at least if you say you have chronic headaches, this lady with headaches of 20 years, I'm telling her, you have to give me 1 month to work with. I'm not going to fix your headaches in 1 month if you had them for 20 years. It'd be ridiculous. Or no, I'd be on Oprah. Well, sorry, Oprah's no longer on TV. So the idea is, give it a chance. Try it out because you never know what's on the other side. I mean, the chiropractor is going to do an X-ray, do an exam, find out if that neck is subluxated, or if the occipital bone, where a lot of headache starts, right, the base of your skull, and those where the nerves come all the way over into your eyes. Those headaches can get incredible responses just by taking stress off the nervous system. Now, think of how much better you will sleep when you don't have a headache. Your neck can get comfortable at night. You can heal. There's so much more benefits as far as the quality of your life that you're not aware of. And why would you be aware of it? Um, so I urge you, as a chiropractor, but also someone, I enjoy treating headaches because there is a challenge. There is seriously a challenge. I might also point out that one of the things I actually came up with, I take credit for this, is the use of a intranasal laser to stimulate the sphenopalatine ganglion, which is a nerve bundle in the back of the behind the nose. And by stimulating that, we're also seeing a good result with certain migraine cases, the tougher ones, where it's a little bit higher up in the brain where the headaches are occurring. Many different types of headaches, not all going to respond to chiropractic care. But if you've got headaches for a long period of time, what do you have to lose? The headache? Well, I urge you to try chiropractic care for your headaches. I'm Dr. Brian McKay, Core Health in Darien. I look forward to helping you and answering any questions you may have. You can always reach out to me at 203-656-3329. No, that's my home number. Sorry. 203-656-3636. 203-656-3636. If you call me at home, I'm more than happy to answer that. All right, listen, I hope you learned something today about headaches, and we'll talk to you soon. Thank you.